Hi, my name is Tao. I'm a pharmacist at the McGill University Health Center. Today, I'll be taking you on a tour of a typical medication room at the MUHC. This video was created for you to better understand how the pharmacy department supplies medication and for you to know where to find various medications throughout the medication room. Understanding where medications is stored is very important for you to be able to access them in a timely and safe manner. Also, understanding the medication circuits is important to comply with accreditation standards. So, let's get started. The objectives of this presentation are: understand where different medications can be found in the medication room, understand the difference between various medication dispensing systems by pharmacy, understand how medication is stocked and replenished, understand how to properly dispose of medications. Before we start, there are a few abbreviations that you might hear during this presentation. The automated dispensing cabinet is often referred to as the ADC. Sometimes you might hear it referred to an AccuDose, which is actually a brand name. A PTA is a pharmacy technical assistant. They are responsible for restocking the medication rooms. They work under the supervision of pharmacists. Medications should be stocked in the medication room in 5 areas: in an automated dispensing cabinet, or ADC, in the medication refrigerator, in the black narcotic box affixed to the wall, also known as the black box, in the medication cart. On the counter and shelves, you will find medications that are ward stock, or also known as floor stock. We will now proceed to go through each area. Let's start with reviewing the automated dispensing cabinet, also known as ADC. The automated dispensing cabinet is where you will find the most commonly prescribed medications on your ward. By having an ADC, you can have rapid access to the most common medications when you get a new prescription. It also stocks emergency medications that you can access at any time. The ADC is usually the first place to look for when you have a new prescription and need to give a medication to your patient, or if you need to give an emergency medication. Access to medication in the ADC varies depending on the medication and the time at which you try to access the medication. For most medications, a prescription needs to be validated by a pharmacist for you to be able to access it. When a pharmacist validates a prescription, they make sure the right medication is prescribed at the right dose and checks if there are any interactions with other drugs or the patient's condition. When you access your patient file, you will find all the medications that have been validated by a pharmacist. Please note that the medication can only be found under their generic name. If the name of the medication that you're looking for is not there, it is either because it is not stocked in the ADC or it is because the prescription has not yet been checked by a pharmacist. Medications that are required during emergency situations are accessible at all time. Examples of these include epinephrine, naloxone, and other antidotes, as well as some parenteral antibiotics. For such medications, you can override the cabinet and obtain your medication without getting a prescription written and validated. In an emergency situation, you do not need to access the patient's profile to obtain these medications. You can search for these medications directly. When the pharmacy is closed, most medications become accessible. At the MUHC, there are ADCs that are specifically designated to contain medications in case they are needed overnight. At the RVH, this ADC is on D9 Center and C8 Center. At the MCH, it is on B8 South. In rare occasions, you might have a medication that still requires validation from a pharmacist, even after hours. These exceptions include very expensive medications or medications that require special authorization or monitoring when it needs to be administered. In that case, contact your nurse resource manager and she will ensure that the pharmacist on call is contacted to unlock the ADC. The ADCs are filled up daily by the pharmacy department. When a medication falls below the minimum quantity, also known as the PAR level, pharmacy receives a report that signals us to fill up the ADC with medication that is below the minimum quantity. The PTA that receives this report will fill up the ADC with the missing medications. Pharmacy also gets a report when the medications are about to expire. The PTA will also replace medications when the current stock is about to expire. Note that only pharmacy staff can restock the ADCs. This was a brief overview of the ADCs. If you wish to get more details on how to use an ADC, please refer to the MUHC Interprofessional Protocol, available on the MUHC intranet. Now, let's move on to the medication carts. Medication carts can be found in the hallways, except at the Montreal Children's Hospital, where they are stored in the medication room. Every drawer of the medication cart has the patient's identification in the front. The medication cart contains medications that are not stocked in the ADC. In each patient's drawer, you will find enough of these medications for the next 24 hours. They are filled up daily by the pharmacy staff and delivered to ensure that you have everything for the patient from 5 p.m. that day to 5 p.m. the next day. The medications are delivered daily by the PTA. They will also remove what was not used in the last 24 hours to avoid errors and duplications. The medication cart has a multi-dose drawer for medications that are packaged in a container that can be reused. Multiple doses can be taken from this container. This is the return drawer where you can put medication that you can return to pharmacy. Returning medications to pharmacy will be discussed later in this presentation. Now, let's go to the narcotic box. The narcotic box contains narcotics that are prescribed specifically for a patient or liquid formulations that cannot be added to the ADC. Each medication should be issued with a narcotic transaction sheet, also known as a green sheet, which you need to fill up every time you administer a narcotic. You will find the card to access this box in the ADC. Further details are provided in the narcotic controlled substance video. Now, let's take a look in the medication refrigerator. The refrigerator that you will find in the medication room is reserved for medication only. Food should never be stored in this refrigerator. The refrigerator has different bins to better organize the medications. Please do not remove them and make sure that all medications are placed in the right bins at all times. In the refrigerator, you will find medications that require refrigeration in order to ensure their stability. The medications may be prescribed or could be floor stock. They may include intravenous antibiotics prepared by the pharmacy or medications of various forms, such as liquid, injectable vials, and tablets. Pharmacy manages the stocking of everything in the refrigerator, from filling up the stock to removing expired medications. Pharmacy also monitors the temperature of the refrigerators once daily. However, if you notice that the temperature of the refrigerator is not between the required 2 and 8 degrees Celsius, you must notify the nurse manager immediately. This is very important in between checks from pharmacy to ensure that the medication stored in the refrigerator can always be safely used. Finally, let's explore what type of medications you will find in the bins on the counters and shelves of the medication rooms. Each ward has a list of medications that are stocked on the unit and are easily accessible. They are known as ward stock or floor stock. These medications do not require a pharmacist's validation before you can have access to them. These are usually frequently used medications that are also associated with a low risk of adverse reactions. Ward stock medications can either be on the counter, the shelves, or in the refrigerator. The ward stock is filled up by a PTA once or twice a week, depending on your unit's needs. If you see that you will not have enough medications between visits, do not hesitate to send a requisition. The PTA also checks for expired medications and rotates the stocks to make sure that the medications with the shortest expiry date is used first. Because floor stock medications can be used repeatedly for different patients, they are manipulated frequently and spills can happen easily. Please make sure to keep this area clean so that medications can be prepared in a clean environment. Now that we've reviewed all the areas where you will find medications on the ward, let's review how to dispose of medications. First, if you take a medication out from the ADC by mistake, you can put it back in the ADC's return bin. When a patient is discharged, there are instances where you can return medications to the pharmacy. However, only medications that are still intact can be returned, such as unopened vials or bottles, sealed tablets, packaged or unopened items. Do not return to pharmacy liquid unit dose medications, open vials or bottles, half tablets, or pre-prepared IV medications. There are different waste management materials available in the medication room. Please follow the poster to ensure that waste generated from medication administration is properly destroyed. This poster is available in every medication room. For disposal of narcotics and controlled drugs, please refer to the narcotic controlled presentation. This sums up the tour of a typical medication room. If you would like to obtain a complete list of medications that are stocked on your ward, you can look through the various lists that are available on the intranet. The pharmacy department's duty is to ensure that you have safe and timely access to medications. If you have any questions, please do not hesitate to contact the pharmacy department. Thank you.